Mr. Brindisi, you're recognized.
Thank you, Mr. Chairman. Ms. Oshinsky, just in response to Congressman Lamb's question, I also would like to see the numbers on the suicide prevention coordinators, because I know in previous testimony, the former national director talked about a surge in hiring. So if you can get that to our office as well, I'd love to see those numbers.
Certainly.
And then my main concern, I represent a very rural district in upstate New York, and I know you all know the challenges of serving veterans in rural communities because of the lack of cell phone service, the lack of internet coverage, the transportation and distances to community-based outpatient clinics or hospitals. So Ms. Oshinsky or Dr. Kroviak, can you speak to the VA's efficiency in reaching veterans who live in rural communities?
Thank you for the opportunity to address how we reach out to veterans in rural communities. And I agree, we've tried to make sure that we have community-based outpatient clinics whenever we can, and that we are expanding our telehealth network. But as you said, we also are struggle sometimes with the bandwidth that you may have in more rural communities. We are working with a variety of private sector folks as well. One of the things I'd like to highlight is we are trying to work with Walmart because there are Walmarts in very many rural communities across the country. Is there a way that we can do that? So that's one of the areas that we're looking at. Dr. Carroll, would you like to add anything in terms of other alternatives?
One of the things that we have developed recently is a program called Together with Veterans. It was developed by our team out in Colorado, and it is a evidence-based program to go into rural communities and to help those communities recognize and connect and support with their veterans in their local communities. We've seen promising results from that, and we are spreading that across our system in addition to what Ms. Oshinsky said about the importance of telehealth services.
Dr. Kroviak.
Yeah, if I could add, we are also very much aware of the challenges associated with providing care to rural veterans, in particular specialty care. So we've developed several products that are now looking, taking deep dives into specialty care coordination for rural vets, as well as the expansion and safety of telehealth.
What else can we do in Congress to help VA reach these veterans? Any ideas?
Well, certainly we appreciate the support that we have from this group and through the funding process. I mean, we have worked very hard to try to expand bandwidth. Sometimes, and as you know, it can be difficult in some of these more rural areas. So I think the awareness, one of the things I think is just so important is that really younger veterans in particular love telehealth. And I think we need to do everything we can to make sure that people understand just how effective telehealth can be. So, Dr. Carroll, anything from your standpoint?
Okay. Thank you. Okay. And then another question I have, Ms. Oshinsky, you mentioned in your testimony that suicide prevention coordinators also do outreach to Guard and Reserve units, and they come to mind as one population that could be served by VA mental health services. And I've introduced legislation, it's bipartisan, the Care for Reservists Act, that would do just that. If Congress decided to expand critical mental health services to more populations, what are the challenges you see in making that work?
It is, thank you for the opportunity to address that. I don't think it's a secret to talk about the fact that sometimes the issues of trying to recruit, particularly in areas where it may be more, where we may have smaller populations, we can struggle with recruitment. So I think that would be something that we would face. However, obviously, if the Congress wanted us to expand those services, we would do whatever we could to make sure that that occurred.
Do you think that you have the staff capacity at VA facilities to serve more veterans?
Well, I think we are serving as many veterans as we can. We are looking at ways that we can expand that. Dr. Carroll?
Yeah. As we continue to expand our mental health staffing, and we have increased our net mental health staffing over the last 2 years, but the demand also increases. And so I think, we are hiring to meet the demand. As demand increases, we need to continue to hire. Support for our training programs is an important component because that's a major way that we recruit providers into our system.
Thank you for recognizing my angst and wanting to participate.
Thank you, Doctor.
I would also really stress the importance of a staffing model. It is near impossible to staff up to the demand when you haven't really measured exactly what you need and where you need to spend your dollars in that staffing.
Thank you all.